Hi, my name is Sarah and I'm one of the physical therapists at the Kitsilano Physiotherapy Clinic, and I'm here to talk to you about using principles from clinical Pilates in physical therapy or your exercises to make better core activation. So the principles that I want to talk to you about are a few. One of them is the idea of elongation. So if you're thinking lengthening throughout your core exercises, oftentimes you'll get a better activation. So what that would feel like if you're trying it in your chair would be grounding down through your sits bones and feeling growing tall out the top of your head, lengthening the back of your neck. So if you do that in seated, you might feel your core engage a little bit to hold you up, naturally bringing yourself into a more upright posture. That's a good way to use or activate your core through any of your normal core exercises from your physio. Another way to get into activating your core from clinical Pilates would be looking at your deep core activation, or how you activate your core with both breath and movement. So if you're setting up through your core here, you can have your middle fingers on your pubic bone and your palms against the side of your pelvis here, and use that as a sensor to see where your core is. If you notice that you get a pulse with your core, so you can see my core going outwards here, you're using some of your superficial core muscles to do your core exercise. To use stability or deeper core endurance muscles that are better for oftentimes for back pain, you would do with your exhale, activation in towards the spine. So bring belly button close to spine. If you can do this with a big inhale into belly to relax and a big exhale to bring core into spine, then you know you're using some of those deeper core muscles, especially if you can do it without holding your breath and breathing while you activate. So what that would look like from the side angle, if we're kind of showing you that core activation, this one is bracing your core, pulsing. Core is moving, but it's your outer core muscles. And then if you're holding your breath, you might look like to hold your core. You can see how that's more of an outward motion. So with this, if we're activating deep core, you would see inhale into belly, let it fully relax, and exhale, bring belly button into spine. And as someone's still talking to you, or you're talking to them while you're exercising, it's a good test to see if you can really do this with breath. So that's one principle with clinical Pilates. And the third principle that I wanted to talk to you about is the idea of segmental stacking. So any core activity or exercise that you're doing that involves movement, sometimes you can add a bit of the sensation of vertebrae stacking on top of each other or moving slowly from each level of your spine to activate your core differently. So for example, what that might look like, if you were doing pelvic tilts with your physio to activate and move your spine, you might get more core activation for a more specific movement. If you're thinking from here, so that's where your tailbone would be, front of your pelvis, you're thinking tucking under body, you can think sacred tail curl, and then you take each layer, or imagine each stack, the vertebrae in your spine, going slowly on top of each other to roll back. You'll notice that will trigger your belly button to come into spine, which is similar to the other principle we were talking about. So what I'm gonna do is I'm gonna take these principles, show you what I could do in a ordinary core exercise without using these principles, and then show the exercise with them. So when people think common core exercises, you might think about using like a sit-up or a curl-up or a crunch. With this one, we'll use, kind of show that motion without thinking about these principles. So that could look like down, and then you're just coming up. And with that, I actually don't feel any core activation there. Something that you might notice is you can feel really tense through your front of your hip flexors. And if you notice that sudden pulse, it's kind of like core activation that we were talking about before. You can grab through momentum through your hips to do that exercise. If you wanted to do it more for your core and use those principles of Pilates, what you do is you'd feel your sits bones in the ground, you grow tall through the top of your head, keeping length and deep breath. Then you would check your core and see if you can bring belly button into spine. So already there, you should feel melting at the front of your hips and more core activation. Next, you would take the movement and you would stack each vertebra to really feel your core. So what I'm doing here is you will see this kind of motion, so like a posterior pelvic tilt, relaxing through the front of here, but feeling your core go into spine. And often, if you're doing a Pilates exercise properly, you'll notice a little bit of a tremor if you're getting really into core. So here, I can actually feel my core working way harder, even though the motion is small, and you're trying to keep your breath. Then, as you come back up, you stack from the higher part of the spine, and then you come slowly back up, looking at that control. It's also a really good way to get good core activation if you know you don't have a ton of movement through your spine. You're like, oh, crunches would hurt me. You can do this small motion and really get core activation.